So ISTEM stands for Instrument-Assisted Soft Tissue Management, and it also comes out of Eastern medicine, gua sha, called scraping. So you see all sorts of different tools. There's multiple branded techniques that do this. What we're gonna do is get some emollient so it's nice and slide. She's having some tightness in her supraspinatus. And I'm just gonna get in nice and gentle, about a 45-degree angle, and kind of glide through there. And I'm gonna go through, and you can feel like the texture of the tissue, which you can't feel with my thumbs. My thumbs is just pressure, tension, and movement. This you can kind of feel, I call it the gristle, or different densities, and you could feel it and I could feel it. And we're doing more of a superficial treatment with this. The idea behind it is we're making your body more work. There's so many nerve endings between the skin and the muscle, so you're just pinging all those nerve endings. You're also creating a little bit of petachia, which is a fancy word for bursted blood vessels, right? So a little bit of bruising or redness. And some of the studies show that initiates a white blood cell, red blood cell response. So I call it bootleg PRP. It's your body's own version of bringing white blood cells and red blood cells together, and that actually promotes a healing response. So it's like laser guided missiles to your healing response or your immune response.
This would be good for my boyfriend too with water polo, right?
Right. Anything that you're going to have a deficit in recovery, this helps. So if you're having deficit in sensory input or guarding, then this helps bring a lot more awareness to it. We're pinging these areas. The technique, the way I was taught, is as soon as you see it starts to get red, for those people who do it themselves, then you're done. So as soon as you get a little bit of redness, then you're done. You don't need to bruise it or mash it. Anyone on blood thinner is obviously not a good candidate for this thing. Another thing people don't do is they just do it passively. So like bring your arm across your body, and now we've got different tension on those tissues, right? So now I could feel that tendon loading differently.